First three speakers got me real amped, and I drank an entire bottle of water. So let's get into it, right? I lived in Houston for a few years. A few years ago, I've been back every now and again. Yesterday, I flew into Hobby, and boy, are my arms tired. Yeah. Just some great healthcare comedy. And I was driving up 45, and I hit scan on the radio, rented a car, and hit KPFT. And on KPFT, which I've never heard before, I heard a speech. An entire radio show, which was a speech that Bernie Sanders gave about the struggles for racial, social, and economic equality over the past 150 years. So that was the entire program. They played the speech, they sped it up so it could fit the block, and at the end, the two hosts said, "In solidarity, y'all," and then signed off. You live in a place long enough and you think you kind of figure it out, but Houston never ceases to surprise me. And it is good to be back home in Houston, Texas. Alright? Y'all want to talk about universal health care? Alright, let's get into it. So I'm not a doctor and I'm not a nurse, and as far as health outcomes are concerned, that's probably good for all of us. But I want to talk to you about universal single-payer health care and why we're told we can't have it and what we have to accept in its place, and where that comes from, and why that's wrong, and what we need to do to realize health justice in America. So let's start by describing the shape and the contours of the enemy. We live in a world in which healthcare is a commodity. That means that the future's on your heart and your lungs, and the chance of whether or not you get diabetes and whether or not your Mima gets glaucoma before age 65 are bought and sold for profit by private companies. You have a bunch of payers and a bunch of providers. Now, providers are doctors, nurses, hospitals, pharmaceutical corporations, physical therapists, the guy at Walgreens that sells you your inhaler, and payers are organizations like insurance companies to whom you pay a bunch of money, and then they in return use some of that money to pay for some of your healthcare costs should you ever need it. Now, not a lot of folks need to use healthcare in a given year. Half of all healthcare costs in America come from 5% of people. But when it happens, providers provide the health care and payers pay for it. Now, in this world that we're told we have to live in, paying for health care is very complicated. See, not all payers pay the same price for the same services. Some insurers pay more, some insurers pay less, and some insurers don't pay anything at all and pass the bill back to you. Whoops. Now, the thing is, healthcare costs have been rising. They've been rising literally since we began measuring them in the 1880s, faster than inflation. Now, providers aren't necessarily clean here. A lot of hospital CEOs find ways to charge more for the same procedures year after year, and a lot more people are getting chronic conditions, things like diabetes and asthma and hepatitis. Now, the good thing is people that get chronic conditions are living longer, which is nice, but this all leads to an increase in costs. And this scares the bejesus out of everybody involved, particularly the payers. Payers, insurance companies, are interested in finding ways to mitigate rising costs. And sometimes that means refusing to pay claims. You've all heard those horror stories. And before the ACA, it meant that payers might refuse to insure somebody if they were sick or had a chance of getting sick. You all have heard the term pre-existing conditions. But still, this wasn't driving costs down. There's this fear that if you make healthcare cheap or affordable or even free, people might use it. And it's really hard to make a profit off of that. So we invented the bad guy. The bad guy is a thing called consumer-driven healthcare. Let me run you through that. It's this idea that you should make consumers, which is just libertarian for people, you should make consumers pay more for the costs of their own healthcare, right? If you make somebody pay more for their CAT scan, or pay more for their MRI, or pay more for their surgery, they will, according to this ideology, turn into smart shoppers, and they'll shop around and find the best prices, and they won't seek unnecessary care, and that'll drive prices down long term. And now I know that sounds like a joke, but a lot of very serious people took that very seriously for a very long time, and in fact, it's the foundation of our contemporary American healthcare system. It's why your annual deductible might be more than your entire savings account. I'm guessing a lot of the folks that came up with this have never been poor and sick at the same time. And all of this builds a really kind of a isolationist, atomized, and frankly, pretty lonely worldview, right? Of what healthcare can and should be. It treats being sick or being poor or being a woman as a self-inflicted sin. It means that if you get hit by a car, or you give birth to a baby prematurely, or you get rabies or something, and you're on the hook for your own costs because it's your responsibility, because it's a matter of personal accountability. And if that accident, or if that illness, or if that pregnancy forces you into a lifetime of crushing debt or medical bankruptcy so that a hospital, a pharma company, or an insurer can turn a profit, well, tough. That's your problem. Should have been hit by the car. Try being born rich next time, idiot. And so we're told this is just the way things are, and that this is just the way things have to be. We are told universal health care is a pipe dream, that capitalist, corporatist domination of our bodies and our health is natural, normal, inescapable, and irreversible. That single payer will never, ever happen in America, and that's just the Democrats speaking. Man, wow, that's a bleak worldview, right? Now here's the thing. It's a big load of horseshit. And you know it's a big load. I said I would only swear once. You know it was a big load. And I'm going to tell you why. And you're going to know the answer before I tell you what it is. You ready? Yes. All right, me too. Thank you, the one person that's ready. Everybody else, you got like 4 seconds left, so I'm going right into it. Back in the 70s and 80s, there was an experiment called the Rand Health Insurance Experiment. This is back in a mythical, legendary time I wasn't alive for, before we had things like co-pays and co-insurance and deductibles, which is what the experiment wanted to test. What happens if you make folks pay for more of their own health care? I don't really make PowerPoints, so I'll spare you the charts and get right in the middle of it. Turns out people who can already afford health care aren't that affected by needing to pay some money for their health care. That makes sense. But people who can afford to pay these costs don't seek care. I don't mean emergency care. If you get hit by a truck, or you get cancer, or whatever, you're still going to go to the hospital, still going to go to the emergency room. No. People who can't afford to pay for health care, who are then forced to pay for health care, don't get primary care. They don't get preventative care. Because we demand they bear the burden of expensive health care costs, they turn their bodies into ticking time bombs until they have a heart attack at work. Consumer-driven health care only benefits the people who seek to profit from our bodies. But there's a happy opposite, and it's real and it's attainable. Everyone benefits when accessing care is affordable and easy. Delivering care, being a doctor, being a nurse, comforting the afflicted, diagnosing, treating, that's all complicated. Paying for health care, that's really simple. And a lot of this hinges on the idea of a thing called the universal risk pool. It sounds kind of wonky. It's pretty simple. I'll run you through it. A risk pool is how many people pool their resources together in order to pay for the healthcare costs of other people in the pool. Now, because most people are healthy, the larger the pool, the easier it is to weather the cost of someone getting very sick or needing a lot of care, right? If 1 out of 10 people get need health care in a given course of a year, it's a lot easier when you've got 300 million people all kind of sharing the cost than if you've got 1,000 people kind of sharing the cost. Now, insurers are an example of risk pools, but they're small and they're fragmented. And one hospitalization, one really weird accident, one premature birth can drive costs up for everybody, which is why your premiums go up 30% year after year. Now, the largest risk pool of all is the universal risk pool. That's the federal single payer. So let's build it. Maybe we extend federal programs that already exist. Maybe that's a little thing called Medicare for all. Because once you have a universal risk pool and a federal single payer, you can use it to do a lot of pretty cool things. Let's go through those. One, you drive down costs. Almost all medical costs in America are set as a function of Medicare. If Medicare has a larger and healthier risk pool, its overall per-person costs go down, right? And therefore, it has the leverage to compel providers to offer fair prices for care. And as a federal entity using public funds, it's not going to siphon 15% of its revenue away for profit like a private insurer would. Amen. That's right. 2, federal single payer lets us disentangle employment from health care. What kind of job you got? That's right. What kind of job you got, or who your employer is, whether your boss is cool or whether your boss sucks, should not dictate whether you are eligible to receive health care. It is cruel that the poorest among us are coerced into remaining in unsafe or unjust working environments from fear of losing health care. And it is crueler still that their children are shackled to the quality of their parents' employer. That is not the America I demand to live in. And three, because the federal single payer, the federal actor, bears both the costs of providing care, that is, paying doctors, paying nurses, home health aides, etc., and bears the costs of not providing health care, e.g. the hell world where everyone gets sick and dies at the same time, it can finally be a tool for realizing actual health justice. Medicare for all is the starting point. It is not the goal. If your population is sick and they are dying because they do not have a place to live, then housing is health care, and you build housing to bring health care costs down. If your population is sick because they don't have access to healthy food to eat that doesn't cost $7 for a carrot or whatever, then food is health care, and you provide them with affordable food options to bring health care costs down. This is the actual work of health justice, and this better world can be ours. There is solidarity in the moral community of universal health care. It gives my life meaning to help others, and it is my honor and my privilege to assist in the care of people around me, even if it's just through my taxes. Those who say that, well, I don't know why I should pay for someone's pregnancy, have no moral ambition and no backbone. The evolution... Oh, sorry, you can laugh if you want to. The evolution of American private insurance is rooted in this cruel, libertarian ideology of individual accountability, atomized personal isolation, and the consumer-driven healthcare movement. It is unconscionable, it is barbaric, and we must exorcise it from our national myth. Boy, you got me real angry now. Which is a more inspirational vision of America, right? The idea that insurance is a little more than a form of future income loss protection? Or is it the idea that healthcare is the people of a nation of plenty banding together to take care of each other? The consumer-driven market approach to healthcare is a relic of the past, like a spooky ghost. And we don't need to carry it with us. We don't need to bring it forward into 2017, 2018. So why stop at Medicare for all, right? Medicare has no lifetime out-of-pocket limit. It has 20% co-insurance, which is why privately run Medicare Advantage plans exist, which are just a way for private insurers to fraud the government using public money. Whatever, we don't need those. Medicare for all is a good rallying cry, it's a clear vision, and it's a great framework. But let's not let that framework get in the way of ambitious policy making. We need universal, single-payer plans with no lifetime limits, no out-of-pocket expenses, and easy access for everyone from coast to coast, plains to go. In this country, we let a third of families go unable to pay for housing or food or heating because they got to pay medical costs. In Texas, we condemn tens of thousands of the uninsured poor to pour into free or low-cost clinics, not to get treated, but just to wait to die. And all because our politicians lack the conviction, the courage, and the moral ambition to try anything else. So what do we do? Yeah, I'm mad too. What do we do? How do we win? By coming to events like this, by talking to our friends and neighbors and families, and not just at Thanksgiving. 55% of Americans want some kind of single-payer program, and that number rises every single day, because single-payer is moral, single-payer is necessary, and single-payer is achievable. So we must demand it of our local officials, and we must demand it of our state reps. We must demand that here in Texas, we permit the simple decency of expanding Medicaid to the people in need around us. And if we don't have any candidates who will fight for single-payer, we got to make some ourselves. I want to thank my comrades, my brothers and sisters, the Democratic Socialists of America, Our Revolution, and the Houston area progressives. I want to thank Local 716. Solidarity now, solidarity forever, solidarity, y'all.